Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservey.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, we have Dr. Brody McCoy. He is an orthopedic surgeon here at East Cooper Medical Center. Thanks for being with us today.
Well, thank you so much for having me.
Loving the bow tie.
Well, thank you so much.
Love,
I appreciate
love,
you.
love
I spend my life tying knots. So I figured if I tie knots in people's body, maybe I could tie one around my neck.
It's like your signature.
I
love it.
it.
All right, so before we talk about all the things you do here at East Cooper Medical, let's just talk about you.
Sure.
Tell us your background.
Sure. Yeah, so I'm a South Carolina native. I grew up in Camden, South Carolina, moved to Charleston in 1988, and I went to undergraduate school here, and then went to medical school here, and did a general surgery and orthopedic surgery residency. So 4 years of college, and then 12 years of school after that. So 16 years of post graduate education.
And you're probably still taking classes.
Still taking classes. So
my
my oldest daughter was in first grade, and I was still training. And I said, "Sweetheart," I said, "either you real fast or your daddy's real slow. You're not supposed to be in school at the same time as your parents." So
I love that.
There's a lot of education.
And a lot has changed over the years. It's evolved with technology and things like that. I'm sure that's exciting for you, right?
Oh, it's very exciting. Just over my career, things have changed a lot, and mainly in surgery and recovery. A lot of things are being done as outpatient surgeries now, where people don't even have to stay in the hospital, particularly now in this COVID area that we're in. That's a big concern that people have. So a lot more outpatient surgeries. I do mainly shoulder, hip, and knee surgery is what I do. And not only surgery, we take care of non-operative problems that people have. There are a lot of different options short of having surgical intervention.
So what kind of issues would that be?
So anybody's having like shoulder pain or hip pain or knee pain,
disc plate or
like
whatever.
a rotator cuff tear or labral tear, or just just anybody that has pain in their shoulder or limited mobility. There's some processes that will lead to some restriction in motion. So we take care of that. A lot of hip and knee surgery as well. And
hip stuff. I used to think that if you needed a hip replacement, it was because you were a lot older.
Yeah, sure.
But that's not the case.
It's not necessarily the case.
Yeah.
We had a girl that was 18 years of age that we did a hip replacement on this year from a genetic problem. That's very, very unusual. But there are a lot of people in their 30s and 40s that are getting hip replacements now who, in years gone by, we never did those because the longevity of the hip implants was only about 10 to 12 years. So you don't want to be 40 getting a hip replacement and only last until you're 52. So
exactly.
that's but now, because of the change in the materials that we use in hip replacements, I'm telling patients now that you can get 30 to 40 years of wear out of this just because of the plastic and the metal is so much more refined, and the technology is there. This all is being 3D printed, and the implantation process is much better. For instance, the knees we do robotically, so it's a robotic knee replacement that we get a CT scan, something called Makoplasty, where we make a three-dimensional model.
And you're really into that stuff,
Yeah, we've done a bunch of those. We did the first robotic knee replacement in the state of South Carolina, about 8 years ago now. So we've got about 8 years of experience with robotics, and I've been very happy with that. And there are a lot of changes there, and the outcomes are very good.
I always have to ask this though: did you play like video games and stuff? Because I always assume that people that do that are really good with like.
It's hard for me to hide this gray hair, so my age would say I'm quite. I missed the video era. Pac-Man, Pac-Man, and that would be would be my era. So but it's a lot of it is robotics. So there's a lot of computer generated stuff. And
does it challenge you in a different way?
There's some different challenges. The refinement. We're talking about cuts to within 1/10 of a millimeter of precision.
Wow.
So 1/10 of the thickness of one of your hairs. So things have gotten so much more precise. And I tell people with as far as knee replacements are concerned, and to be able to fit the knee perfectly is what's the difference between an okay outcome and a great outcome. So, for instance, if your foot's a size 7 and I give you a size 8 shoe and say wear this the rest of life, you're not going to be happy. Or if I give you a size 6 shoe, you're not going to be happy. The only way a 7 foot is happy is with a 7 shoe. So in knee replacements, the only way we can get a perfect fit is via robotics.
And so I think, always the moral of the story is to come see people like you.
Sure.
Get it checked out. Don't ignore it.
That's right. You don't want to wait too long.
Give us some just advice on, some of the ways that if we do ignore it, it obviously could get a lot worse, right?
Exactly right. So sometimes people are, again, there's a lot of treatment that we do is not surgical. So I don't want people to think they come to see us, they got to have surgery. Yeah. So probably 90% of the people that we see, we don't operate on. So it's all conservative. We try therapies, other treatments. We do a lot of, orthobiologics, conservative injections using the patient's own blood. PRP, which is platelet-rich plasma, where we spin down the blood and get the growth factors and inject that in there. So they're all kind of options that we have short of surgical intervention.
And y'all have
But
got
if
great physical therapists.
We've got
too.
great physical therapists, and if you wait too long, I mean, it can lead to problems with recovery because your muscles get so weak, you get deterioration of the bone. So it's best to know early. You come in, get some X-rays, get an exam, just to see where you are on that timeline. And we say, hey, listen, we can do some conservative management, and we expect that you'll be able to make it 5 or 10 years before you ever need to have anything done, or maybe never.
Well, and you could have a problem with this knee, and you're trying to compensate and be messing up the other one, right?
Mainly the other hip. We see it all the time.
Oh,
So
okay.
people that have
Gotcha.
a bad knee on one side, it usually affects the contralateral,
hip.
the other
All
side
right.
hip. It can be the other knee as well. So, I mean, your whole body is a unit together, so it just has to be in sync.
I feel like we could talk all day.
Yeah, I could keep going.
All right. Well, for more information, of course, you can always head online to eastcoopermedctr.com.